Hello everybody, it's Gary here. Like I told you, I'm going to interview my doctor and my bariatric specialist, and I'd like to introduce you to my friend and Dr. Tim Reel. And going to ask him a few questions today, and y'all going to have to see me in my glasses because if I didn't have them on, I'd have to have a poster board with questions on it in order to be able to see them further than right here. So I guess we'll get started.
All
Tim,
right. Yes, sir.
will you tell us a little bit about your background and what led you to get into the weight loss field?
I have been doing internal medicine for 25 years, and I've always had a great interest in doing wellness, prevention, trying to get people healthier. Spent a lot of my early career doing critical care medicine, taking care of really sick people in the hospital, but always with that idea that I wanted to try to keep people from getting to that point. And so early on started trying to look and see what can make the biggest difference in people's health. Always was focused on diet and exercise, even though I often gave poor examples, poor teaching about how to eat right. But in the last couple of years, I've really become interested in weight loss and what that does to many different illnesses.
Cool. Well, I'm glad you got involved because here I am. Well, since you're here, how involved are you with the Way to Wellness program?
I serve as their medical director. I've been working with Leslie for over 2 years, and as their medical director, I'm very involved in the initial examination of patients, making sure that we try to exclude all the other issues that may be contributing to their weight problems, serving as one who looks at all their labs, monitors their progress, trying to intervene if they get stuck with their weight loss, and serving as just advice for all their other medical problems that go along with their weight struggles.
That was an extremely good answer. You got,
you.
got the next two questions.
Oh, good.
In the process of answering that one.
All right.
So we're going to skip to number 5.
All right.
Does a person have to be your patient to take part in the program, or can they continue to use their current doctor?
Actually, you do not have to be one of my personal patients. We work with many of the other primary care doctors around. I have primary care docs that send me patients because of my interest and the facilities that we provide for that. We'll work with people's personal doctors as much as we can. Sometimes and often we are making some changes in medications. Sometimes we'll ask the patient to ask your doctor if this is okay. Sometimes we'll send them a note and certainly be able to help facilitate any labs, EKGs, issues that we find that they need to be aware of.
Okay. Let's see here. I know the answer to this, but I'm going to ask you anyway and let you answer it. Does lack of sleep and stress make it more difficult to lose weight? And what do you recommend to a person that is struggling in these areas?
Boy, that is for most of, I guess, us Americans, we are very stressed, sometimes have very poor sleep habits, and it plays a tremendous role.
Yeah, that's my life. Yeah. So
you answer this one.
Stress and no sleep. It causes a big thing in the world.
Yeah. And some of us, some people react to stress by not eating and losing weight and struggling in that area. Of course, we never see those type of people in a weight loss clinic. But for the most of us, when we're stressed, we'll start eating, we'll make poor food choices, and then the more we eat, the more we're hungry, and it's just a vicious cycle that we help try to break here.
I agree, especially when you're tired, because when you're tired, you're hungry. Because you want something to try to keep you awake.
Yeah, sometimes we don't know. I think our hunger triggers are sometimes misunderstood. Sometimes fatigue, that we'll treat that with eating because that'll keep us awake, and that activity helps keep us distracted from falling asleep. But there's some certainly medical issues that get involved with that. We've many patients struggle with sleep apnea, and sleep apnea is goes along. The heavier people are, the increased incidence of sleep apnea occurring. And then once that happens, they're more tired, and that is a vicious cycle. That if we can ever get that reversed, get it started down, then we can see some great results. Getting people even off CPAP machines.
Yeah, well, that would be a good goal, but I've slept with mine for so long, I don't think I'll ever give it up.
Well,
Especially during the summer when you put some cold water in that humidifier.
Yeah.
You got a nice cool breeze. It's
Yeah.
nice. Well, since we're there, what about hormone imbalances?
Yeah,
Do y'all
that's-
check for those and how they affect it? And,
Yeah, probably the predominant one that we look at here in the clinic is your thyroid. And we're always looking at that. Of course, there are other hormones that are involved. For men, there's testosterone that we typically don't look at. We'll encourage patients to maybe ask their primary care doctor about that. But one of the things that's become evident is people who are overweight have low testosterone. And once you start losing the weight, your testosterone levels actually will come up. Even though you may be on treatment for that, that low T will improve with weight loss, as a lot of things do with weight loss.
well, so far I haven't found anything that doesn't improve with it. You already answered this, but I'm going to ask it again anyway. Do you and your staff work with the patient healthcare provider if needed, for example, to address how the program may affect existing medical issues?
Yeah, there are a lot of things that are involved. A lot of patients come to us on multiple medications. We may ask may have to get, especially for some of the appetite suppressants, that if they have a cardiologist with other with rhythm abnormalities, I have to see a note from the cardiologist saying it's okay to use those type stimulant medications. If they're on certain antidepressants, we know that those can lead to weight gain, and there may be some suggestions that we'll give to maybe get them to discuss with their primary care doc. Often, as people are losing weight, we have the privilege of reducing medications. So we'll find that a lot of their people on blood pressure medicines, we're able to reduce our antihypertensives, we're able to maybe decrease some of their diabetic drugs if they're diabetic. Even some of their cholesterol medicines maybe have the option of being decreased as their weight comes down. We may take that, we may be able to do that. We may send those labs and reports back to their primary doc and say, hey, look at this. What can you do?
What about people with kidney problems, like my brother-in-law who starts this evening who's had a transplant? And my wife, who's thinking about waiting on her kidney doctor to get back with her.
Well, some of those we ask their nephrologist, is it possible? Now, there's always a concern because we are a high-protein diet, and the nephrologists restrict a lot of protein from the diets of kidney patients. From what I could read from a nephrologist that was posed that question several months ago, her opinion was that if you may not push the protein levels as high as you might, and you want to monitor that more closely. You want to do maybe some urine tests, maybe want to do a 24-hour urine test to evaluate the protein excretion to see if it gets worse. We typically will draw labs every 6 weeks on our patients. For patients like that, we may in 2 weeks after they get started, we may want to look at those numbers again.
Yeah, because she's waiting on her kidney doctor, because I can't say the word for it right correctly anyway, because I call them nerfologist, like the football and little dart guns. Let's see here. When would you advise a person to seek professional advice to help with their weight loss?
I think if people have done some of the things that done some things on their own, they've tried increasing their exercise, they've tried to count calories, and they're still stuck and they're not making progress. After several months, if they have especially with other medical problems, I would tell them to start seeking help early on and not waiting for the problem just to keep getting worse and worse.
Like 200 pounds you got.
Well, that might have been helpful.
Yeah. It made it easier anyway.
Yeah, well, our goal would have been achieved a little quicker.
Yeah, a little quicker. Let's see here. What about medical side effects with the Way to Wellness program?
We always have to, with some of the medications that we use, they are stimulants. Sometimes that affects people's sleep, and they're not as able to go to sleep as well at night. If that's the case, we'll modify the medications, may change it, may stop it altogether if they don't need it. The medications are primarily for suppression of the appetite. They do not have an effect really of speeding up metabolism. So you can absolutely lose weight without all the appetite suppressants. So we have to watch for palpitations. We always monitor blood pressure. Every visit that you come in, we're going to be checking not only your weight, but your blood pressure, making sure we're not seeing any problems there. One of the biggest things we see, if somebody comes in on a lot of medications, we get their weight loss started, we've got to start reducing their medications pretty quickly for blood pressure especially, or their blood pressure will start bottoming out. And that in essence is a good problem, because that means we're going toward the root of the problem. As some have experienced early on, a big diuresis or a loss of water weight occurs, and they may not be sleeping as well at night because they're constantly up at night, like they've taken a diuretic. That can occur, and for those, we just want to be sure that we keep their electrolytes balanced.
Okay. I'm going to skip that one because you just answered it. You've already answered the next one, which is, I'll ask anyway. The ongoing input and follow-up from a healthcare provider, while during and after I've reached my goal. Is there any follow-up on it?
Yeah, we certainly have a maintenance program here, and part of that just involves getting on the scales. But a lot of times, and for that, we can have some patients that will come in on a monthly basis just to weigh, just to be sure that they're maintaining their goal, to see if they have any problems. But really, we want you back with your primary care doctor to continue making sure everything else is in working order.
Well, that's all the questions I had. You got anything else you want to say?
I'm proud of you.
Thank you. I'm proud of you too. I'm proud of you for getting me started.
That's awesome.
I appreciate
it is a thrill to see the improvement you've made already.
Thank you. And of course, now when I'm smiling, I'm actually meaning it a lot. So,
Awesome.
Well, I'm going to say goodbye from Tim, and we're going to go get with Leslie.
See you later.
This is Gary out. Bye.